Hi, good morning. My name is Kay Elizabeth Gonzaga, and I am here to tackle the importance of infection prevention for the healthcare workers. So, the infection prevention for healthcare workers. So, infection prevention and control, or the IPC, is a practical evidence based method to protecting patients and healthcare workers from preventable infections. So, healthcare workers are the key factors in preventing infections from spreading. And do you know that there are risks to healthcare workers? Number one is the direct exposure to the pathogens. Number two is the airborne transmission. And number three is the inadequate personal protective equipment. And also, number four is a high patient volume. So, do you know that not only the healthcare workers are affected, but also patients are affected if not taken seriously? Do you know that? When healthcare workers contract infections, it can be significant implications for patients' outcomes like transmission to the patients, disruption of services, and also the exposure of vulnerable populations. So, as healthcare workers follow the infection prevention, the workplace should achieve the following. Number one, enhance infection prevention. Number two, improve mental and physical well being. And lastly, increase the productivity in the healthcare settings. Nosocomial infections are relatively common and affecting some patients, but thus vary on the types of facility, number of patients, and the control measures at the workplace. So I'll give you some, and here's some examples of unintentional contributions to the spread of nosocomial infections. Number one is the poor hand hygiene. Number two is the contaminated surfaces. Number three is the lack of proper PPE. Number four is the improper disposal of infectious wastes. So, what are the importance of implementing standard precautions? What do you think? So, implementing standard precaution is a crucial in preventing the transmissions of infections in the healthcare settings. This can be done by hand hygiene, personal protective equipment, safe infection practices, the environmental cleaning, the waste management, and the educational trainings. Philippines has its own training and infection control, and I think this is important that it has to be a basic knowledge and being implemented and not only a course or a program only. The Health and Safety Solutions are conducting seminars to those who wants to learn about infection control and prevention, which consists of 4 hour discussion and 2 hours assessments, and done through a webinar. Even if the infection control are taking place but the body has no protection against the infectious diseases, healthcare workers might catch it despite of the precautions. That's why it is important to have vaccinations. So, what are the consequences of not complying to infection control? It includes the patient harm. Non-compliance increases the likelihood of healthcare-associated infections, potentially causing harm to the patients. Also, the risk of infections. Healthcare workers who do not comply with infection prevention measures are at increased risk of acquiring spreading infections. The transmission chains. Failure to follow protocols can contribute to the chain of infections within healthcare settings, leading to the outbreaks that impact multiple patients and staff members. Next is the legal consequences. Noncompliance with infection prevention guidelines may result in legal consequences for healthcare workers and the institution. And also the damage to the professional reputation. Noncompliance tarnish the professional reputation of the healthcare workers and also the reputation of the healthcare institution. So here are the points to remember. In summary, Healthcare workers play a crucial role in infection prevention within the healthcare setting, and the key points include the risk mitigation, patient outcomes, nosocomial infections, standard precautions, consequences of non-compliance, and the healthy workers, and also the crucial role of the healthcare workers. So that's it. So bye guys! I hope you enjoy and learn something about my oral presentation. Bye!